Let's talk about the oral hygiene and the bitterness and the taste problems during the cancer therapy. Now, why does it happen? Some people say that I'm just not able to taste the food properly, my appetite has gone down, or there are some oral ulcers, there is a burning sensation, I feel some raw or bitterness in my mouth all the time. So this is also an important side effect, and it does happen. Why does it happen? Because whatever therapy you're taking for cancer treatment, in fact if you take any antibiotics also, your mouth will be bitter. Have you experienced that? Tell me. Yes. So any medicine if you take, your mouth is going to have that tinge of the taste of the medicine. Why? Because body fluids secrete or excrete those drugs. So even if you take antibiotics, your mouth will be bitter sometimes. For days together, you will not have the taste of the food normally. And cancer treatments are a little stronger than the antibiotics, definitely. So whatever treatment you are receiving, whether it's a tablet or injection, chemotherapy, targeted therapy, do not cause that much of bitterness in mouth. But yes, to large extent, whatever medicine you are taking, it is bound to excrete in the saliva in your mouth. So when it is excreted in the saliva, mainly the tongue and the coating of the mouth, though there will be definitely that bad taste in the mouth throughout. Now this bad taste, if you don't do anything about it, whole day if your mouth is empty, and your appetite will go down. Now what happens? Your taste buds are also affected. Now taste buds are affected, so taste you're not getting the taste, so you're not having the appetite. You're not having the appetite, you will not eat the food. You will not eat the food, and then you will become weak. And if you become weak, then cancer treatment delivery will become difficult, because we cannot give treatment full dose and proper intervals to patients who are not eating well. If you don't eat well, your general nutrition will come down, your fatigue levels will increase, you will not have that stamina or the fitness. And so simply giving treatment without having the proper nutrition doesn't work. You need both. You need the medicine and you need your nutrition too. So if you have to maintain your proper nutrition, the most important is to maintain a good oral hygiene and to take care of your mouth. Now, drugs are going to get excreted in your mouth. Chemotherapy or whatever drugs, targeted therapy, everything is going to get excreted in your mouth. So mouth is a major excretory organ, your saliva. So how do you reduce this side effect? I should say not 100%, but to a large extent you can do many things to control this bitterness in the mouth or even development of oral ulcers. So simple thing is maintain oral hygiene. Brushing twice a day and keeping your mouth clean. In fact, gargling, rinsing with salt water, warm salt water gargles every 2 to 3 hours throughout the day. These are some of the simple tips to keep your oral hygiene fantastic. So that is point number 1. Second, how do you combat the bitterness? Now bitterness is there and taste buds are not working. So here my suggestion is, you can use a mixture of honey and ghee, organic honey and organic ghee, mix in a glass jar, keep it, and this mixture you can take about half a teaspoon, maybe 4 to 5 times a day. Just keep in mouth and let the tongue coat the entire mouth. This is second. Now this is very nice. If you see, ghee and honey both are anti-inflammatory. They're rich in vitamins, antioxidants. They generally create a coating layer which will be preventive for formation of ulcers. So it will prevent forming ulcers, it will take care of the bitterness, it will also activate and boost your taste buds. So this will help in maintaining your appetite as well as your nutrition. Now third point is, now whole day what will you do? Because if your mouth is empty, the bitter taste keeps coming, and sometimes that bad saliva, bad watering mouth happens. So in this scenario, what you can do is, you can keep a spice of your choice, anything. See, many people keep long or cardamom, elaichi or pepper or tulsi leaves you can take, or ginger candies you can keep, or simply a slice of ginger or a cinnamon stick. See what suits you. Keep anything, whatever you like, in your mouth, or just keep it throughout the day as much as possible. Now this also has many benefits. Now this will actually reduce your bitterness, because now you have something to counteract the bitterness. Second, it is also anti-inflammatory. All our house spices are very good. They are natural antibiotics and natural anti-inflammatory. So make use of them. So this you can try definitely. It reduces the bitterness and your appetite improves, your taste buds are activated, And the last point would be nutrition. Now make sure that you have a lot of fruits, vegetables and curd. The best I have told in my previous video also is a bowl of curd and fruits. This is a mixture of prebiotic and probiotic. Eat slowly. So when you have this mixture slowly, what happens is curd is there in your mouth for a long time. The curd is full of probiotics, bacteria, good bacteria. So it gets a chance to coat your oral cavity completely, and that also helps in your oral hygiene. See, all the good bacteria will be out. You will not have those good commensal bacteria either in your mouth or in your intestine because of the disease and because of the treatment, both. So now we need to replenish those probiotics by having curd and fruits, vegetables. So give the prebiotic and probiotic, both. So a good mixture of curd and fruits is the best example of having prebiotic and probiotic. So these are few of the tips to take care of your oral bitterness and oral hygiene. So hope this helps. If you found value in this video, please like, share and subscribe, and let me know what was your biggest takeaway and what else you would like to hear. Thanks a lot.